Hi, I'm Bob Sweeney, Station Manager for the City of Juneau Cable TV Channel 991, back for another discussion with Dodge County Administrator James Mielke to find out important issues concerning Dodge County government here in the month of May. Good morning, Jim.
Good morning, Bob.
Welcome back.
Thank you. Glad to be here. I'd like to remove my mask to help the communication a little better. With us today, we have Public Health Officer Abby Sauer. She's been here before, and thankful for Abby being able to make the time to be here this morning and to provide us an update. There's a lot of information going on the vaccination process.
Yes, there is. So thank you for having me. Thank
You're
you for having
welcome.
me.
So go ahead, Abby.
Sure. So I will start right away, and I'm just going to bring up our numbers first, and then kind of give a update on testing, and then talk about vaccinations. Before, just a little update on our numbers. We had been seeing a steady decline in numbers. The last couple weeks we had seen a little bit of an increase again, but it's now it kind of went down a little bit this last week. So kind of positive with news with that. So not huge numbers, but still we were a little cautious with those numbers going up. But with a nice little decrease, we're positive that hopefully those numbers will keep going down.
Great.
But we still are seeing positives every day, but our contact tracers have been right on top of them and still being able to reach them within 24 hours. So we're doing good with that.
Great.
Our testing has been really good as well. We are still seeing people coming in to get tested, seeing a lot of negative tests as well. And our test site is still open in Beaver Dam on Mondays at the old Bassett Furniture Shop is how most people are kind of aware where that is in Beaver Dam. It's on Mondays from 11 to 5 p.m. and that is through the weekend before Memorial Day, or the Monday before Memorial Day. So through May, we'll be having that test site, and then we'll be evaluating it at that time to see if we will continue having a community test site or not. So
now that's staffed by the National Guard.
That
correct?
is. It's coordinated with public health and emergency management, but then it is staffed by the Wisconsin National Guard. So they've been a huge asset to our community in supporting us with that. So we're happy that they can continue, and we'll see what happens in May if we'll continue that. A lot of hospitals and clinics are testing, so we may not need that support anymore in our community.
Okay.
Vaccines is huge on the radar. Everybody's talking about vaccines. Wants to know, what's the upcoming news on that. We still are vaccinating in Dodge County Public Health at our building on Wednesday, Thursday, Fridays, where we've been doing Moderna, and we have done Johnson & Johnson. Right now, I wanted to look at the numbers for our weekly report just to share with everybody, but our numbers as of Sunday, 33.5% of Dodge County residents have had one dose of vaccine, and as of Sunday, 25.7% of Dodge County residents have completed a series. So our numbers are still steadily increasing with our percent of people being vaccinated, and more sites are open. More and more vaccine is available, and so we have a lot of availability now. I think last time I was on here, I was talking about how the demand is greater than the supply, and that has kind of evened out now, where we have the supply available and our demand is kind of reaching, or they're equal. So we're hoping people are able to find vaccine. At Dodge County Public Health, we still have our vaccine hotline that people can call, and we also, on our website, people can submit an interest form or request form, and at this point, if you submit a request or leave a message on our hotline, if it's during the week, we're responding to those within 24 hours. And so pretty much even that day, you'll get a response back to schedule an appointment. So that's a little different than a couple months ago. I think we were weeks out on calling people when they requested. So so that's wonderful news that we have the vaccine now, and we have the slots to get people in. So right now, anybody 16 and older is eligible for vaccine. So you don't have to be in a certain work category or essential category or age group. Anybody 16, well, I guess if you're 16 and older, that is an age group, but 16 and older, you are eligible. But the one little information with that is if you're 16 and 17-year-olds can only get Pfizer vaccine. So with that Pfizer vaccine, not every vaccination site has Pfizer. So if somebody does call public health, we have not been having Pfizer at our vaccine site, but we can help people find a site where they do have Pfizer and kind of connect those 16 and 17-year-olds with the vaccine. But the vaccine is available, and we really encourage people to really look at that. If they have questions about the vaccine, on if they should get it, and kind of what those side effects are, we really encourage people to call our hotline. A nurse can talk to them about that, or even reach out to their clinician, because we want people to be comfortable getting that vaccine. And we really encourage people who are hesitant to reach out to their doctor and talk to their doctor about that. Or again, talk to a public health nurse, and we'll give them as much information as we can as far as why you should get it and that kind of stuff.
Okay.
What's the latest, Abby, with the Johnson & Johnson? I know you had a great clinic on a Saturday.
Yep.
With Johnson & Johnson, and then shortly after that, there were some issues nationally.
Yes.
And so Johnson & Johnson wasn't available, and now it appears like it will be available again.
Right. So Johnson & Johnson was paused after there were some side effects identified, or individuals with blood clots. Now, there were 6 individuals that they had originally identified out of almost 7 million Johnson & Johnson vaccines given. So it wasn't a huge amount, but out of caution, the CDC and FDA chose to pause the Johnson & Johnson just to investigate it a little bit more. And now last Friday, I believe, which was the 23rd, is that, or
Yep, yes.
roughly around there?
23rd, you're right.
The CDC and FDA did unpause it in a sense, or it can now be given again, and that is because they've identified that yes, there's a risk, and the risk of the clot will be now in the fact sheet that individuals get, so people are aware that there is this risk, but the risk is very little compared to the benefits of this vaccine. And so the chance of getting this kind of blood clot is rare, and it really has only been identified in women 50 years old and younger. So that's where if people, again, are hesitant on what should I get this vaccine, talking to public health, talking to their clinician, because maybe if it is a younger woman, the Moderna or Pfizer may be the best vaccine for them. And that's something we can talk to them about, or again, their clinician. But with the unpausing of Pfizer, we are hoping that we're still waiting for the official state guidance, or state Wisconsin Department of Health Services saying, yes, go ahead and start giving it. I'm assuming that's going to come any minute at this point, and then we'll be able to start giving Johnson & Johnson again. Because I know there is a want for that one, because it is a one-dose vaccine.
Now, wasn't one of the reasons they put a pause on the Johnson & Johnson was to find out the proper treatment for people who had the clot?
It not necessarily, is more to identify were there more individuals than just the 6, which they did identify more individuals that had this side effect. I believe 9 more actually was identified, but and it was also to identify, was the vaccine the cause of these clots, or were there other underlying factors? So, because this is not a new kind of condition, it is something that has been around. Women who are on birth control actually have a higher incidence of this. Smokers have had this kind of clotting, so it's not something necessarily brand new. It was more like, was this the cause, or was there something else that caused this?
Okay.
With the ramping up with the Johnson & Johnson vaccine now, since it's been paused, do you anticipate from a supply standpoint that there'll be some type of lag in receiving doses, or how does that work as far as requesting doses, or with the Johnson & Johnson, is it not required to request them, that they just send them? How does that work?
Right. So we have been in Wisconsin, we've been just allocated the doses of vaccine in Johnson & Johnson. So we didn't necessarily request specific, we want this much Johnson & Johnson, this much this Moderna, this much Pfizer. They just send what is available. So as far as, will we have more now that there was a pause, or will it be delayed as well? I'm not sure how that's going to look at this point. So I do anticipate that we'll start getting Johnson & Johnson, though, for sure, and we'll be able to, and our partners will get it as well, and we'll be able to start getting that vaccine out.
If an individual contacts public health, can they request Johnson & Johnson versus Moderna? How does that work?
Yeah,
internally?
Yeah, definitely internally. If we have both vaccines available, we will offer an individual. We set up a Johnson & Johnson clinic, and we have our specific Moderna clinics, and then we'll offer people one or the other. At this point, we're only doing Moderna. So, but if we've had individuals who say, "Well, can I stay on the wait list till till you have Johnson & Johnson available?" We will definitely do that, or we'll refer them to, if we don't have a specific Johnson & Johnson clinic, we'll refer them to one in the area, because, like I said, our partners had been getting that vaccine as well. So.
Great. And Abby, if you could touch on a little bit, you and your public health team have been making some outreach efforts in the community as well, correct? If you could touch on that a little bit.
Yeah, so this is exciting. We've actually worked with the Aging and Disability Resource Center, and came up with a plan to outreach to individuals that are homebound, or individuals that may be able to leave their home but don't have transportation. So with that partnership, individuals can call either public health, our vaccine hotline, or they can call the ADRC, the Aging and Disability Resource Center, and they can coordinate for either transportation. So the county does have a transportation through the ADRC, and they'll come and pick up individuals who don't have transportation and get them to one of our clinics. Or if they are homebound individuals, they go on a list. And actually today we're doing our first homebound mobile clinic. So we're going to multiple individuals' homes and vaccinating them in their homes, since they can't leave their home for medical reasons or whatever reason it is. If they're on our list, we'll go to them. So I'm super excited about that, because I know there are people out there that can't get to us, and so we are working on how can we get to them. Additionally, we're working with businesses. We've outreached to businesses in Dodge County, and we're looking at how can we work with individuals, and again, go to them where they are at work and do mobile clinics at their facilities. We have done a few mobile clinics already. We've gone to some food production businesses. We've gone to schools. We've gone to just individual businesses and been able to do clinics there, which just makes it more, easy. Mm-hmm. It's easier for people because we're there instead of them having to come to us. So excited about all those efforts.
That's great, Abby. Any questions you'd like to ask?
No, you did a nice job.
Okay. Thank you, Abby, and again, thank you for everything you and your team are doing for Dodge County. It's really appreciated, and you can tell the excitement that Abby has with this, and even today with the mobile clinics, that's fantastic to do that outreach, and so that's a great effort. So thank you.
Thank you.
Switching gears just a little bit, the May county board meeting is on Tuesday the 18th, and actually part of the agenda will include a presentation, an update to the board by Abby. There's always questions by supervisors wanting to know where we stand, either with the number of cases and especially now with the vaccinations, and so it'll be a great opportunity to have Abby provide most update information to the county board supervisors regarding the vaccination status in Dodge County. So we're looking forward to that, and as we've seen for the past year, every week there's new information coming forth and new efforts, and so we'll see what happens by the middle of the month. So we're looking forward to that. So, and also now that we're getting into the month of May, it's hard to believe, but we're beginning to ramp up the 2022 budget process, working with department heads and getting some ideas looking ahead for 2022. We'll also be beginning the process to update our 5-year capital improvement plan, which would cover the years 2022 through 2026. Some upcoming events, and I'd like to touch on this briefly, that the Dodge County Fair is scheduled to begin on August 18th, and that's as we stand here and early in the month of May, all plans are moving forward for in-person event. There was a meeting in middle of April involving the members of the Dodge County Fair Board, Public Health, myself, County Board Chair Russ Cockey, talking about the county fair, and all plans are being made to have the fair begin in person and on time on August 18th, and we're looking forward to that. Also, the Dodge County Park System typically has Fall Fest at Harnischfeger Park, and the Friends of Dodge County Parks have announced that the Fall Fest will go on as scheduled, and the Saturday, I believe, is the 25th of September. So we're looking forward to that since Fall Fest was canceled in 2020. So it's nice to see that there's some events that were paused in 2020 and now are being planning to move forward in 2021. So I think that's great to have a sense of normalcy as much as possible as we continue to march forward into 2021. Also, I wanted to touch on just a little bit from the federal level. I touched on this a little bit at last month, that there's the American Rescue Plan Act of 2021, which was signed by President Biden on May 11th. And part of that rescue plan is there's a direct allocation of federal dollars to all counties in the United States. It's based on population. The Dodge County allocation is just a little bit over $17 million. Expenditures are required to be finalized by December 31st of 2024. As we are here early in the month of May, the U.S. Treasury has not released the official guidelines as to eligible expenditures for those dollars. However, but we are under the understanding that those guidelines will be released early in the month of May, along with the first payment. With this program, 1/2 of the allocation is scheduled to be received within 60 days of the signing of the legislation, which would put that at 60 days would equate to May 11th. So we anticipate, from the county perspective, of receiving approximately $8.5 million by May 11th, and hopefully at that time there will be guidelines issued as to eligible expenditures. However, in advance of that, we internally have worked through a process which was presented to the Dodge County Board in April, that number one, there will be a plan for the expenditures once the guidance is released, since we have until the end of 2024 for the expenditures. There's not going to be a great immediate rush to try and find projects, but we want to plan very carefully and look at how we can invest those dollars for the benefit of the county, whether it's infrastructure or other long-lasting type of improvements to the county versus, since it's one-time money, not for a single purpose. And so we will be working with the county board on a plan. Also, any expenditures would be required to be presented to the finance committee and authorized by the county board. The funding itself will be totally segregated. It's going to be put into a separate account, so those funds aren't going to be commingled with other dollars that Dodge County has on hand. And so we're looking forward to begin the process and working with the finance committee and the county board on a plan for improvements throughout the county following whatever the U.S. Treasury guidelines are. So we can certainly have more information on that in the months ahead, but that's just kind of a preview, because there's been a lot of talk about this from a national level on this American Rescue Plan Act, and this is how it impacts Dodge County. And I should also note that every village, city, and town is also going to have an allocation, and that allocation is a pass-through from the federal government to the state to that local either village, city, or town, where the county allocation is a direct allocation from the federal government. It does not pass through the state first. So it's going to be an interesting time for all local governments with this somewhat unexpected infusion of federal dollars, and how that may look as we go forward for the next couple of years.
All right, good. Anything else?
No, I think that'll wrap it up for the month of May, and we're looking forward to the summer officially beginning here shortly.
Thank you both for coming in.
Thank you, Bob.
Thank you.